Well, good afternoon. My name is Dr. Elizabeth Joy. I'm an associate professor in the Department of Family and Preventive Medicine in the Division of Public Health, and I'm a family medicine and a sports medicine physician, and really it's my interests in physical activity that bring me to the table, since as our air quality declines, our risk of health-related problems due to outdoor physical activity increases. And as you can see from the slide, I'm going to talk about dust. And I'm not going to talk about the dust bunnies in your basement. You know, I'm going to talk about how climate change and how human behavior increases the dust that we are exposed to. And it's dust that can make us sick. So worldwide desertification due to climate stress is already causing an unprecedented increase in dust storms. This year, major episodes have occurred in China, Iraq, Iran, Pakistan, Saudi Arabia, Afghanistan, Africa, Australia, and closer to home in Arizona. And these trends are expected to continue. Dust storms can travel thousands of miles and even become distributed throughout the global atmosphere. Political events are already evolving, some as a direct result of climate change that, if allowed to unfold, will likely make the health consequences of Great Basin dust even worse. The proposed pipeline to drain the aquifers of central Nevada and western Utah and ship that water to Las Vegas will add even further water stress to an area of the Great Basin as large as the state of Vermont. There is an application, as you know, before the Army Corps of Engineers by the Great Salt Lake Minerals Corporation for permission to greatly increase the amount of Great Salt Lake water they are allowed to divert to settling ponds for mineral extraction. If that is allowed, the water level will drop and thousands of acres of dry beach will be exposed, creating a new source of dust pollution contaminating Utah's air every time an storm front moves in. There have been well-documented and profound health consequences where these kinds of water diversion projects have occurred elsewhere. The Aral Sea in Uzbekistan is a lake with high salinity that's not unlike the Great Salt Lake. And in 1960, it was the fourth largest lake on Earth. However, it was drained to grow cotton in the surrounding desert, and now it's only 10% of its original size. And tens of thousands of people who depended on the lake have since been displaced. Blowing dust is now dry lake bed. The blowing dust in the now dry lake bed has resulted in local life expectancy dropping from 65 to 61 years, with rising levels of many serious diseases, including both throat and esophageal cancer. The Owens Lake in California has become a dry lake bed because its water has been diverted to Los Angeles. And whenever the wind blows, it becomes the largest single source of particulate air pollution in the United States, and monitors have recorded levels 23 times higher than allowed. The closest town, Keeler, California, exceeds these standards on average 25 times a year, even though residents produce almost no pollution in the town itself. So even without water diversion projects, hotter temperatures and less precipitation will result in widespread loss of native vegetation in the already water-stressed Great Basin, which will in turn leave more areas likely to become huge sources of dust or particulate matter pollution. Higher temperatures and dust storms have been linked to valley fever, or coccidiomycosis. It's a disease caused by a fungus in the soils of many parts of the desert southwest and the Great Basin. The American Academy of Microbiology estimates that about 200,000 Americans contract this disease every year. It can be a chronically debilitating disease, which is difficult to diagnose, is more of a threat to people who are immunocompromised, to diabetics, and to pregnant women, and is actually fatal in about 1 in 1,000 patients. And some southwestern states have already seen a 400% increase in the number of cases in the last decade. 1 gram of dust can contain as many as 1 billion microorganisms. There is now evidence that respiratory diseases like influenza and SARS in humans and foot and mouth disease in livestock are among the diseases that can be transmitted by dust storms. Dust from the West Desert also contains residual radioactive isotopes from the over 900 nuclear bomb detonations that occurred in Nevada between 1951 and 1992, including plutonium, uranium, cesium, and many others. And any developments that increase public exposure to this radioactivity could increase the risks of diseases linked to chromosomal damage such as cancer and birth defects, immunosuppression, and numerous other disease processes. Nevada soils are also a source of significant quantities of erionite, which is a fibrous material which is similar in configuration to asbestos and causes the same type of lung disease and lung cancer that asbestos does. In Turkey, where villages have been exposed to erionite and asbestos, the lung cancer they cause has been responsible for over 50% of total deaths. Dust storms from the Great Basin will also bring toxic heavy metals like mercury into our airspace. And I'd like to ask Dr. Mansell Pierce to address this in greater detail.